Hi guys, I'm Gavin Labiel and we will be learning today about communication disorder, speech and language impairment. Our learning objectives for these lessons are able to identify and understand different types of speech disorders, able to identify and understand language disorder, and learn on how to deal with children who have speech disorder and language disorder. Our topic outline is definition. First is definition of terms, followed by speech disorder, three categories of speech disorder, types of speech disorder and how to treat them, what is language impairment, types of language disorder, how to teach students with speech disorder and language disorder, and finally conclusion. So the terms to understand in this lesson are impairment, disorder, communication, language, speech, speech disorder, receptive disorder, and expressive disorder. We will each tackle these as we go along. Impairment. Impairment is a deterioration in the functioning of a body part, organ, or system that can be temporary or permanent and can result from injury or disease. An example of which is speech impairment, which we will tackle throughout this lesson. Disorder. Disorder is an illness of the mind or body. An example of this is anxiety disorder and post traumatic stress disorder or PTSD. Um, PTSD, just a fun fact, PTSD, most, if not probably a lot of people who get PTSD are soldiers since they experience a lot of trauma in the war zone or where they are deployed, and every time they come home from war and back to normal civilization, they tend to get PTSD. So that was just a fun fact. So let's continue. Communication. Communication is an exchange of information and the expression of feeling that can result in understanding. An example of which is communication between two people. So basically, communication means that when two people or two or more or even a group is conversing or talking and understanding each other and sharing information, that is communication. Language. A system of conventional spoken manual or written symbols by means of which human beings, as members of a social group and participants in its culture, express themselves. Speech. The faculty or power of speaking, oral communication, ability to express one's thoughts and emotions by speech, sounds, and gesture. Speech disorder. A speech disorder is a condition in which a person has problems creating or forming the speech sounds needed to communicate with others. This can make the child's speech difficult to understand. So let's begin with speech impairment. So, what is speech impairment? Speech impairments are disorders of speech sounds, fluency, or voice that interfere with communication, adversely affect performance and or functioning in the educational environment, and result in the need for exceptional student education. There are three categories of speech impairment, and these are fluency disorder, voice disorder, and articulation disorder. We will each tackle this as we go along. So let's start with fluency disorder. Fluency disorder is when you have fluency disorder, it means that you have trouble speaking in a fluid or flowing way. You may say the whole word or parts of the word more than once or pause awkwardly between words. This is known as stuttering. You may speak fast and jam words together or say often. This is called cluttering. So basically, fluency disorder, as it states in the definition, it is when you can't speak in a fluid way, or you can say the things you want in a fluid way, which sometimes you would stop or repeat a word or repeat half of the word or the letter of a word, which results to stuttering. So basically, that is fluency disorder. Voice disorder. You may have a voice disorder if you have a problem with pitch, volume, tone, and other qualities of your voice. These problems occur when your vocal cords don't vibrate normally. So, voice disorder is when a person or a child cannot control his or her voice or his or her tone. So, he or she is speaking at a tone that is very high pitch or is a very low pitch, and his or her tone may be very high or very low, and he or she has no control over it. So that is voice disorder. Articulation disorder. Articulation refers to making sounds. The production of sounds involves the coordinated movements of the lips, tongue, teeth, palate, which is the top of the mouth, and respiratory system, which is the lungs. There are also many different nerves and muscles used for speech. What are examples of speech? Wait, before that, an example of articulation disorder is when a person cannot pronounce words or letters. An example of which is when a person cannot pronounce the word S and pronounce S as, which is uh, th. That is an example of articulation disorder when a person or a child cannot pronounce certain letters or certain words. For example, there's also another child who cannot pronounce the word R. Instead, he pronounces R as a W, which if he says rabbit, which he means rabbit, but what he says is wabbit, that is articulation disorder. So let's continue. What are examples of speech disorder? Examples of speech disorders are childhood apraxia of speech, dysarthria, orofacial or myofunctional disorders, speech sound disorders, and stuttering. So let's begin with childhood apraxia of speech. Childhood apraxia of speech, or better known as CAS, is an uncommon speech disorder in which a child has difficulty making accurate movements when speaking. In CAS, the brain struggles to develop plans for speech movement. With this disorder, the speech muscles aren't weak, but they don't perform normally because the brain has difficulty directing or coordinating the movements. Symptoms and how to treat childhood apraxia of speech. The symptoms are delayed onset of first words, a limited number of spoken words, the ability to form only a few consonant or vowel sounds. Now take note, these symptoms are usually noticed when between 18 months and 2 years old and may indicate suspected CAS. To teach a student with CAS, the teacher must be very patient and find a way to make sure the student is comfortable and learning at the same time. Now let's move on to dysarthria. I don't know how to pronounce this. So dysarthria. Dysarthria is difficulty speaking caused by brain damage or brain changes later in life. Symptoms and how to treat dysarthria. A child or adult with dysarthria may have slurred nasal sounding or breathy speech, a strained and hoarse voice, very loud or quiet speech, problems speaking in a regular rhythm with frequent hesitations, gurgly or monotone speech, and difficulty with tongue and lip movements. The therapist may recommend strategies to improve speech, such as slowing speech down, exercises to improve the volume or clarity of speech, and assistive devices such as a simple alphabet board, an amplifier, or a computerized voice output system. Orofacial myofunctional disorders. An orofacial myofunctional disorder, or OMD, is when there is an abnormal lip, jaw, or tongue position during rest, swallowing, or speech. You may also see this when there are prolonged oral habits like thumb or finger sucking when they were still children. Symptoms and how to treat orofacial myofunctional disorder. Symptoms are speech distortion, particularly a frontal lisp, chronic open mouth positioning, dental abnormalities such as overjet and open bite, tongue thrust when the tongue pushes against or between the teeth during speech or swallowing. And these are the ways to treat orofacial myofunctional disorder. Each child's treatment program is different and focuses on tongue and facial resting postures, swallowing, speech sound production. Now, speech sound disorder. Have trouble saying certain sounds and words past the expected age. This can make it hard to understand what a child is trying to say. Speech sound problems include articulation disorder and phonological process disorder. Now, we will discuss both of this now, and please take note. Articulation disorder is a problem with making certain sounds, such as sh. So that is articulation disorder, just as I have stated a while back when when I was discussing articulation. Second is phonological process disorder. It's a pattern of sound mistakes. This includes not pronouncing certain letters. Symptoms of articulation and phonological process disorder. Now, let's start with articulation disorder symptoms first. Leaving off sounds from words. Example, saying "coo" instead of school. Adding sounds to words. Example, saying "play" instead of "play." And distorting sounds in words. An example of which is saying "thith" instead of "this." So this person cannot pronounce the word S and pronounces as TH, as I have again stated a while back. Swapping sounds in words, an example of which is saying radio instead of radio. So he swapped R and W and made R with a W sound. But what he meant, or what he or she meant, is the word radio. So the symptoms for phonological process disorder are saying only one syllable in a word. An example is saying "bye" instead of "baby," or simplifying a word by repeating two syllables. An example of which is saying "baba" instead of "bottle." Leaving out a consonant sound. An example is saying "at" or "ba" instead of saying "bat." And changing certain consonant sounds. Example, tap instead of cat. So he changed T. I mean, he or she changed C into T. How to treat those with speech sound disorder. The speech language pathologist can put together a therapy plan to help your child with his or her disorder. These healthcare providers work with children to help them. Notice and fix sounds they are making wrong. Learn how to correctly form their problem sound and practice saying certain words and making certain sounds. Let's proceed with stuttering. Stuttering, also called as stammering or childhood onset fluency disorder, is a speech disorder that involves frequent and significant problems with normal fluency and flow of speech. People who stutter know what they want to say but difficulty saying it. Have difficulty saying it. For example, they may repeat or prolong a word, a syllable or a consonant or vowel sound, or they may pause during speech because they reach a problematic word or sound. So, symptoms of stuttering: difficulty starting a word, phrase, or sentence, prolonging a word or sounds within a word, repetition of a sound, syllable, or word, brief silence for certain syllables or words, or pauses within a word or broken word. Addition of extra words such as if difficulty moving to the next word is anticipated. Excess tension, tightness, or movement of the face or upper body to produce a word. And anxiety about talking and limited ability of effectively communicate. How to treat stuttering. A few examples of treatment approaches, and in no particular order of effectiveness, include speech therapy. Speech therapy can teach you to slow down your speech and learn to notice when you stutter. You may speak very slowly and deliberately when beginning speech therapy, but over time, you can work up to a more natural speech pattern. Electronic devices. Several electronic devices are available to enhance fluency. Delayed auditory feedback requires you to slow your speech, or the speech will sound distorted through the machine. Another method mimics your speech so that it sounds as if you're talking in unison and with someone else. Some small electronic devices are worn during daily activities. Ask a speech language pathologist for guidance on choosing a device. Third is cognitive behavioral therapy. This type of psychotherapy can help you learn to identify and change ways of thinking that make stuttering worse. It can also help you resolve stress, anxiety, or self esteem problems related to stuttering. Lastly, is parent child interaction. Parental involvement in practicing techniques at home is a key part of helping a child cope with stuttering, especially with some methods. Follow the guidance of the speech language pathologist to determine the best approach for your child. Now, let's move on to language impairment, and this is relatively small, so let's begin. Language impairments are disorders of language that interfere with communication, adversely affect performance and or functioning in the student's typical learning environment, and result in the need for exceptional student education. Types of language disorder. There are actually three types, and we will discuss it each as we go along this lesson. The first is a receptive language disorder. Children with receptive language disorder have difficulty understanding language. They struggle to comprehend words they hear or read, as well as what others are saying. They often respond in ways that don't make sense. An example of this is if a person asks, "Where is the dog going?" A person with receptive language disorder, since cannot comprehend what the other person is saying, responded in a way that doesn't make sense. Instead of answering the question, "Where is the dog going?" the child with receptive language disorder responded, "The dog is brown," which of course doesn't make sense since the question is where, but the child with receptive language disorder answered in a way that he or she is describing the dog instead of answering the question where. Another is expressive language disorder. Excuse me. Expressive language disorder. Children with expressive language disorder have trouble using language. They may be able to understand what others say, but have trouble speaking with others and or expressing their thoughts, feelings, needs, and ideas through language. The disorder can affect spoken, written, and sign language. An example: a 3-year-old child who speaks in two-word phrases only says "mommy car" instead. What they mean is "mommy's that's mommy's car." So instead of saying the whole phrase, the child only uses two words to express what he or she means. What he or she means is "that's mommy's car," but what he or she says is "mommy car." Now let's move on to mixed receptive. Mixed receptive language disorder. Children with both disorders at the same time have difficulty understanding what others say as well as being understood by others. So basically, mixed receptive is a mixture, as it says in the name, is a mixture of both receptive language disorder and if expressive language disorder because again, receptive language disorder means that a child cannot comprehend what he or she reads or hears, and expressive means he or she cannot express his or her thoughts or feelings towards another person. So, mixed receptive is like having both of those. They cannot comprehend or understand what you are saying to them. At the same time, they cannot express themselves to you or to other people, which, in my opinion, when you meet someone with mixed receptive, it is very hard to communicate with that person because again, they cannot comprehend what you're saying. At the same time, they cannot express themselves to you. But again, it's hard, but it's not difficult to communicate with these people. How to teach students with speech disorder and language disorder. There are four things I think to a teacher must do to teach students with speech disorder and language disorder. First is patience. Second is understanding. Third is support. And lastly, properly designed lessons. A teacher must have patience because, again, as stated, for an example is stuttering. A child or a student that is stuttering will have trouble finishing a sentence or a word or even a phrase. So a teacher must have patience and make sure to let the child finish what he or she is trying to say so that way the child gets to express what he or she is trying to say, and at the same time the teacher understands the child properly. So that is why I think a teacher must have patience. Another is understanding. A teacher must have an understanding because a teacher must be understanding because first of all, these students are having a hard time as it is every day because they cannot communicate. At the same time, some of them can't even comprehend what others are saying to them. So a teacher must be understanding and put the teacher's self in their shoes so that a teacher might understand how difficult it is for a child like them who are experiencing hard communication every day. So a teacher must be understanding towards those students with speech disorder and language disorder. Another is support. Teachers must support these students because again, some of these students feel like they are humiliated or embarrassed because of their disorder. So a teacher must find a way to make sure that those students feel comfortable, and at the same time make sure that the students open up to the teachers, so that both of them will have harmony in the classroom. Lastly is properly designed lessons. A teacher must find a way to create a lesson plan for these students, so that these students can learn at the same time, have fun doing it. Because again, it will be hard to teach these students, but again, it's not impossible. So a teacher must properly design a lesson to accommodate each student with different speech disorder and different language disorder, so that the students will learn at the same time, have fun in school. And also it would motivate them to learn, knowing that the teacher is really working hard to make sure those students can learn. Lastly is my conclusion. In conclusion, I can say that dealing with children with speech disorder and language impairments is hard, but it doesn't mean you can't communicate with them. You must be patient and understanding with them. Be patient, because there are others like them who are having trouble speaking, like I said, with stuttering. And be understanding and learn to find a way that you can communicate with them in a manner that suits both of you. So these are the sources I used to create this lesson. And for those of you guys who want to have a copy of this PowerPoint, just PM me or just chat at RGC so that I can provide you with a PowerPoint. And again, thank you guys for listening. I hope you guys learned a lot from my lesson, and thank you.